Okay, so I'm gonna give this talk on the concept of functional training. I'm gonna kind of explain what functional training is. Fairly new. It's really the polar opposite of bodybuilding training. It kind of came to. I first learned about it at a seminar when I was a fitness manager for New York Sports Club back in 2001. I'm going to give my background briefly in health and fitness. Started off earning my bachelor's degree in exercise science from Montclair. During that time, I got certified to be a personal trainer back in 1999. And as I was approaching the end of bachelor's degree, I knew I wanted to open up a personal training studio in the area. But then I wanted to go right into grad school, so I was debating between chiropractic and physical therapy school. And I had a history of low back pain growing up, and physical therapy always got me better. But the only reason I leaned towards chiro and went to chiropractic school is because I felt like you were more of your own boss. Because physical therapists today usually still have to work under a script from a medical doctor. So went right into chiropractic school, graduated in 2008. And then opened up the personal training studio in Caldwell right away, and the chiropractic practice, and I have a physical therapist that works for me. And then just brought on my assistant Maria, who's a licensed massage therapist, and now she's a certified personal trainer. So everything is going great there. So now functional training, the definition for functional training is it's exercise to keep you functional throughout your activities of daily living throughout life, from middle age into your golden years into retirement. What that means is, at 60 or 70 years old, can you walk around Verona Park one time without pain? Can you sit through a 2.5-hour movie without pain? Can you play around the golf, whether you're 50, 60, or Peter's age, 67. So, and when I say the polar opposite of bodybuilding training, the general public, most people, they learn how to exercise as a bodybuilder. I'll give you an example. So they're in the gym, you're doing bicep curls, you're doing overhead press, you're doing deltoid raise, you're doing tricep push downs, you're doing leg extensions, leg curls. Those are all for the superficial skeletal muscles. Nothing to do with the core, the muscles that stabilize your spine, the little segmental muscles that go vertebrae to vertebrae. So those exercises are really much lower on the totem pole. So, if you're spending a half hour, 45 minutes working out, which are really, the guidelines to working out are really about 2 to 4 days a week, every other day. You want to spend your time wisely. And the thing you want to focus on is the core strengthening, functional training type exercises and flexibility. Here's a question for everyone. What do you think is a more important? Well, let me run through a few core exercises so everyone knows what we're talking about. And the core is really made up of 31 muscles from your knees to your ribs. So just some of the basics, the foundational exercises. You have your pelvic tilts, where you pull in your abs tight. So this is tight, but I'm still breathing. So my spine is now stable. So from that position, you go on to step 2, right there. Now my low back is still pinned in. I'll put my hand under someone's low back, make sure they're doing this right. If they lose their low back when they raise their legs, then I know they're too weak to move on to step 2. So, everyone is at a different level when we start. So another one is a low back bridge. 5-second hold, you're mainly contracting the glutes. When someone masters this, we could do it with their legs up on the ball. Just toss me that ball. This is a stability ball or physio ball. So it's a little harder with your legs up on the ball. So you're going to bridge up and hold, 5-second hold. To make it real hard, you can start to do a leg lift off there.
That's for a 30-year-old.
Well, it's a progression. You just progress people week by week. You could bridge up and hold, extend each leg like that. You could get into a plank where you're in this position, forearms and toes. You're going to pull your abs in. So right now you can see the shape of my low back. It's kind of curved, so I'm stabilizing my spine. If I do it like this, completely wrong. I'm setting my low back up to be hurt. So you got to be careful. Who you're dealing with, who's training you, that they have the proper education, hopefully a bachelor's degree or some further education than just a 3-day certification class. So, that's a basic core exercise, and then there's a lot of stretching. There's the hamstring stretching where you have a strap or even a jump rope and you're pulling your leg this way. So this is important. This is the safe way to stretch your hamstrings. My low back is neutral. Then you bring it in, you stretch the glutes. And all these stretches are a 30-second hold. So, what happens is, and I see people do this all the time, the days of stretching your hamstrings like this are basically scientifically disproven. Because what am I doing with my spine? I'm losing my natural curve. I'm going like this. Now I'm pushing all of the discs towards the back of the spine. And that leads to disc bulges, disc herniation. So, these exercises are really a fine art. I tell people, especially people with pain, it's really a chess match, and you need to deal with someone that's well educated and well experienced in fixing these type of problems. I have patients come in and they're like, they have pain, they went to a chiropractor that didn't do much for them, or they went for physical therapy and maybe it was a busy place and not much improved. And then they come to see me and I sit there one-on-one for an hour really teaching them form, and I tell them form is important. It's really not just a matter of, oh yeah, I did some back exercises. It's not that simple. Because as part of an exam, the most important part of the exam that really any rehab professional will do is looking at your posture, from the side. Like if a shoulder's higher, or if you have forward head, where the ear is past your shoulder, then you have tight hamstrings. If the hamstrings are tight, it pulls your pelvis down, and then look what happens to the head. So now, those are misalignments, basically. You're out of alignment. And when you're out of alignment, that's what speeds the onset of arthritis. Because arthritis, everybody gets arthritis. If someone comes into my office, whether they're 35 or 65 years old, if they tell me they have arthritis, I'm thinking to myself, well, of course you do. Everybody gets arthritis. As our skin gets wrinkled as we get older, arthritis is the same thing on an x-ray. It's everybody gets arthritis. The key is delaying the onset of arthritis, slowing down the degeneration of your joints. So lifting like a bodybuilder, like these heavy weights, or doing like a CrossFit type workout where you're taking heavy weight and you're coming up like this, like 30 times. I mean, the wear and tear in your rotator cuff doing something like that is just, it's the opposite of the functional training. You're not giving yourself the best opportunity to play golf at 7 years old, or really to enjoy quality of life when you're retired. So, and I've done a lot of reading on peer-reviewed literature, and so the science today really points in the direction of moderate, intense workouts. Not high-intensity type calisthenic workouts. If you're playing a collegiate sport or you're 25 years old, you could get away with those type of crazy things like jump squats and just all this stuff like jump lunges and jump hit the ground, do 10 push-ups, jump up, that kind of stuff. I do not do that stuff anymore. I used to do that stuff in my late 20s, and I was teaching exercise classes doing that, and I probably degenerated my joints at a more rapid pace. So, the key is really the functional training. I'm going to bring her in, lay on the table, lay on your back or your head over there. I'm just going to lead her through a couple exercises, and then the stretches as well. And I'll kind of want to make this like an open forum. Any questions, just throw them out as we go. I'd be happy to answer them. So basically, if I'm going to stretch someone, there's a couple certain stretches you really want to do, because you want to decompress the low back area, because that's where the most of our compression is, and probably the most common area for pain. So you want to stretch someone's hamstring. You want to keep it straight. And again, all of the stretches to increase your range of motion are about a good 30 seconds. So you get the hamstring, you bring it this way, you get the glute. Now let me know if it's going too far or not far enough. Communication with the client is very important. You don't want to just bend someone back and you end up causing tendonitis. And then you bring the leg across, good there. You go external rotation of the femur, and then you bring an internal rotation. So there's a bunch of different things. And then, the beauty of what I do, I teach everyone how to do this stuff on their own. because these type of workouts, you really want to do a functional training workout, like ideally 3 days a week if you could do it. 2 days is going to happen sometimes because life gets in the way, but if you're doing it 3 times, you're pretty much on the right track. And unfortunately in my business over the 6 years, I've seen people come in, in their 60s, 70s. Some people haven't worked out a day in their life in like 30 years, and I get a little upset because I know if they were doing this type of stuff 20, 30 years ago, they'd be in a lot better condition than they are now.
How long are these workouts, Steve? How much time?
And I go to New York Sports, come down and work out. Sometimes I'm in and out in 45 minutes, the most an hour. Anything over than that is overkill. And like, it's interesting, I call it a cardio warm-up because the American Heart Association, their guidelines for physical activity for normal, healthy adults is about 10 to 20 minutes of cardio a day, 3 to 5 days a week. So when you get there, before you're doing this type of stuff or any kind of weight training, and I'll do some bicep curls, some overhead press, but that's at the end of the workout. That's really, I call that stuff, that's lower on the totem pole. So if you only have a half hour to work out, you want to do your cardio warm-up, 10 to 15 minutes, walking, elliptical, whatever you want to do, some bike. Then you want to get on the mat and do a bunch of this stuff with the stretching. And then after that, then you're hitting the bicep curls, some lat pull downs, and then your internal, external shoulder rotation. Like if a cable machine is here, you grab this, you're going this way, and then you grab the weight and you're coming this way. That strengthens the rotator cuffs. Now the rotator cuffs, those are the deep muscles in the upper body. They're underneath the deltoids, the biceps and everything. And the purpose of the cuff, it actually cuffs your arm bone into your shoulder socket. So I kind of coined the term as the rotator cuff to me is the core of the upper body. So I start with the internal, external rotation all the time. If I don't get to a lateral deltoid raise, I don't really care. Because if you think about it, throughout the day, we're brushing our teeth, we're combing our hair, we're carrying groceries into the house. Our deltoids and our biceps are getting a ton of work. So if I don't get to them at the gym, I don't care. But the exercises I just did on the table, that I'm going to have her do, start doing some low back bridge. Knees bent, arms at your sides, 5-second hold, 2, 3, 4, 5, keep going. So she's mainly working her glutes, primary. Secondary is the core here, the quads and the hamstrings and the low back. You can't reproduce this stuff through everyday living, And then a lot of the problems is the posture, is the alignment. Like, 8 out of 10 people have some forward head going on, where the ear is past the shoulder, and then they lose the curve here. It's all a domino effect, basically. And what happens when your alignment is off like that, you're now speeding up degeneration of the joints and you're speeding up arthritis. And it's the same as a car. If the alignment on your car is off, your tires are going to bulge maybe on the inside or the outside. It's the same premise with the bottom, or with the body. It's called Wolff's Law, actually. Bone will lay down new bone along the lines of stress. So if you're carrying your head this way, you're probably going to develop some bone spurs in the anterior cervical spine. And a bone spur is just a form. Let me get Bob and then you're next.
Yes, regarding the delay of the onset of arthritis,
Yeah.
this applied to osteoarthritis as well as rheumatoid functional training. Could that help?
Oh yeah, definitely, everything. I mean, rheumatoid is a little different animal because that's a systemic condition.
Okay.
But pretty much everything. I mean, it's this type of stuff is your first line of defense. Like someone was just asking me, all of a sudden I got bad shoulder pain, and maybe the doctor, the ortho recommended a shot right away, or an oral steroid, or an oral anti-inflammatory, because that's all they could do, or they could write you a script for physical therapy. That's the second line of defense. You want to make sure you're doing the rehab first because there's no side effects.
So if you're on some of these side effects, if you're on some of the medicines for arthritis, with the functional training, you can gradually wean yourself from that.
Well, hopefully, yeah. I mean, I've seen it happen to a lot of people. Now, some people, they've been so deconditioned and haven't worked out like this for so long that, the arthritis is there and it's pretty bad. And sometimes you can't get them to the point of no pain. And I could figure that out within like 3 visits, 3 to 4 visits. I mean, even 2 to 3. If there's no change, and then it's a chest match. A lot of times it's one stretch or one exercise fixes the alignment and gets rid of the pain, which a lot of people don't realize, but I've seen it firsthand.
People can be optimistic with functional training.
You know, one of the biggest examples is, and I'll get to your question. I'll send someone for an X-ray, and they have, from the side view, they don't have a good curve here, or it's actually called straightening of the lumbar lordosis. And then they get an MRI, and it shows bulging discs, maybe a herniated disc. The ortho's, oh, it's, you know, possibly an epidural. No. If their spine is straight, it's not supposed to be straight. So then we give them, hop off there, let me just show a Cobra Stretch. So then you want to start to give them a Cobra Stretch to do, where you're coming up in this position. You exhale, you do about 10 reps. This can be done every day. I've had people where within 2 days, the sciatic pain went away. You know, and there's plenty of people that have gotten epidurals and even surgery. And if you don't fix the alignment, you could give epidurals all you want. It's not going to change. It's not going to change the pain. And you know, I'm passionate about talking about this because, from my experience, the general public isn't as educated in this. Because, you know, personally, I think when you have musculoskeletal pain, unless there was a trauma or a broken bone, or unless there's a history of cancer or something like that, the first line of defense should be a physical therapist or a sports chiropractor like myself. Because 9 times out of 10, you're going to get them better. And now they're not taking the oral anti-inflammatories, which could have long-term damage on the kidneys, and they're not getting an epidural shot, which there's side effects. You know, too much corticosteroids demineralizes bone. So, and you don't want to purposely demineralize your bone if you can avoid it, because our bone demineralizes as we get older. So, you had a question?
Yes. Talking about core exercises.
Yeah.
Pilates are all core, correct?
Yeah, Pilates are all core, and when I tell people, if they come into me with a lot of pain, I'd rather them learn the foundational exercises from me before they graduate into a Pilates class. The reason being is because I have a bachelor's degree and a doctorate in this. I've been doing it a long time as a trainer. So if you go into a Pilates class, you know, that Pilates instructor, you know, they could have just got certified by taking a 3-day class. You know, they're not focused on you one-on-one. I mean, you're dealing with low back pain. You know, I've seen it all the time. I go to New York Sports Club. I see trainers having people do squats like this, like with their knees are going past their feet. Horrible on the low back. Or then if someone has low back pain, the last thing you want to do is a squat. You don't want to do a squat, you don't want to do a lunge. You have to be careful. You want to do more of like these type of exercises, like all your leg raises. And this is considered core, and it's also working your thigh muscles. So you want to do all 4 planes of movement. That's a side leg raise.
You want to strengthen your back muscles, though.
Yeah. Low back bridge. That's quads and low back muscles. And then, you know, pulling your abs in tight with your legs up. See, these are your, I'm strengthening my spinal stabilizing muscles right here, which I wish I had the picture to show you guys, but they're little segmental muscles that they're called rotors and multifidi, and they go from vertebrae to vertebrae. They're segmental muscles. They're also called postural muscles. They're the muscles that maintain your posture when you're at rest. So if I'm sitting like this, slouched like this, which is just horrible, you can see my spine turned into a C. My ears past my shoulder. If I get like this, you know, how did I get from here to here? I didn't move my arms or my legs. I'm moving my spine. Really the little muscles that line my spine. Those are your deep back muscles. So that's all you're strengthening.
Where does yoga fit into this core strengthening exercises?
Same that he said as Pilates. Very good workout. But when you have a lot of pain, and a lot of people that come in, they don't do this type of stuff, I tell them I prefer them to really learn this routine first, get the pain under control, and then go into yoga or swimming, you know, jogging. But then the bodybuilding exercises, you do them as well. It's just not the whole 3 sets. Like we grew up and everything was like, I have to do chest and tris on Monday, and then back on Tuesday, you know, and I'm doing 3 sets of chest press, 3 sets of overhead. Complete overkill. That's complete overkill. You know, I do my workout, a good functional training workout, it's about 10 to 15 minutes of cardio warm-up. Then I'm on the mat doing this stuff for about 10 minutes. I'm doing some stretches. I get up, I'm on like this bench that you do like a side raise, or you're doing planks. Like this is a great one, a side plank. So now I'm going to hold this for 30 seconds. And this is an isometric contraction. So what I mean by an isometric contraction is I'm holding the contraction and there's no movement in the muscle for 30 seconds. So basically there's two kinds of contractions. There's isotonic and isometric. Isotonic is like bodybuilding, where say you're doing a bicep curl with a dumbbell and the muscle is shortening, lengthening, shortening, lengthening. Isometric, you hold the dumbbell and there's no movement. So your postural muscles that maintain your posture, those are mainly isometric contractions. You know, like right now, I'm contracting the muscles because I'm sitting up straight. So there's no movement. So in order to rebuild your core, it's a lot of isometric contractions, like that plank for 30 seconds, or the one like this, where you do the pelvic tilt and you hold your legs up like that. So I'm contracting here, or even arms underneath your glutes like that. You almost see, you could see the vibrations in my abdominals. You know, and the whole thing, like sit-ups are kind of disproven, where I don't even have anyone do a sit-up anymore. It's just the science has kind of gone away from that, because it's isotonic. You're going up and down. You're only working the superficial rectus abdominis. You're not really doing anything for the deep core. So it's interesting stuff, and I've had a lot of good experience with people just doing this type of training.
Ruptured discs, where you get that twist at the lower part where you get stenosis of your toes. In order to relieve that area, what would somebody do?
Stenosis of the lower spine, and then you get like pins and needles in your feet or numbness in your feet. Yeah, well, conservative care, this type of stuff. Hopefully it works. If it doesn't work, you know, say you're trying it for 2-3 weeks, 2 weeks, it doesn't work, then possibly an oral anti-inflammatory. Still no relief. If there's a lot of pain, numbness in your feet, then you think about an epidural shot. So it's you want to take the first line of defense, which is this type of care. You know, I tell people it's like you have to get your hands dirty, you know, and that's me. I get my hands dirty with people, you know, and the massaging too. That's actually a big part of it. Lay on your stomach with your head over here. So part of the treatment, if someone's in pain, say across their low back, because if your alignment is off, what happens is if your alignment's off, the muscles will go into spasm. You know, you feel that tightness or there's pain. So a deep tissue type massage or a ischemic compression is, you know, I'm kind of digging in here, using a lot of force. I'll even use my elbow, like a good 30-second hold. And I tell people, let me know when I hit an area that hurts, like a painful spot. And that's where you actually want to focus on. If they have upper back neck pain, bring your arms up that way. If there's upper back neck pain, I'm kind of working in this area or down in here, like almost causing them pain. But that's really what you need, because what happens is it relaxes the muscle spasms. As you relax the spasms, the pain goes away. But then also you're doing the stretches and the exercises to correct the alignment. So it's really the therapeutic exercise, the stretching, and the massage work are probably the three most important facets of the conservative care. Physical therapy, sports chiropractic, whatever you want to call it. Who else has a question?
What about knee problems? My husband has knee problems. And, you know, there have been times when he has worked hard in the garden or something like that, and it hurts more until the next day. And on the next day, he has relief. And so, are there some exercises that can be done to relieve that situation?
Definitely. Well, you want to go into your back. You want to strengthen the integrity of the knee. And the foundational exercises for that, there's every plane of movement for your leg. So you want to dorsiflex the foot, and now you contract the quad. And the reason you dorsiflex, you get a stronger quad contraction, and you raise it up and down slow. So it would be about 10 to 20 reps, straight leg raise, depending on, what kind of condition or the age of the patient is. So you do about 20 of those, take a break. And then also you want to make sure, an ultrasound machine, you know, I'd probably start you off with ultrasound around here for like 5-10 minutes. That's with the gel to get heat into the joint. And then I like to take it through max range of motion through flexion. A lot of times with extremity joints, you know, you have pain going into flexion, and then someone will stop doing it because it hurts. And a lot of times you need to actually take them through the pain, because then it releases the area basically. Because what happens is if you have pain and you don't move, it's called use it or lose it. If you don't move it through the pain, you know, this isn't for everything. It's like I said, a lot of times it's a chess match. Everybody's different. You'll start to get something called tissue fibrosis, or like frozen shoulder, where now you have a permanent loss of range of motion. And then turn that way. So then next would be a side leg raise. Again, you dorsiflex your foot, internally rotate, coming up about 45 degrees. So she would do 20 reps of that, and then inner thigh leg raise. So take that up and over, dorsiflex. 20 reps of that, and then the fourth motion, lay on your stomach for prone thigh extension. Just like that. And this is all in the glute, hamstring. But all this stuff strengthens the integrity of the knee. And then some like leg extensions and leg curls. But those are like the next level. You always want to start with the foundational exercises. Like I tell people, you have to start at ground zero and work your way up with the strength. And that's your best bet. And with the massaging, of course, too. Yeah. Anyone else?
Beautiful. Very nice.
All right. Thank you very much for listening.
Very informative.